Are you trying to find more work-life balance in sports physical therapy? That's what I'm covering inside this video. My name is Dr. Chris Garcia. I help sports and cash-based physical therapists thrive in their clinical practice and improve patient outcomes long-term. When we look at what work-life balance is, this is such a large topic currently in sports physical therapy, orthopedic physical therapy. And I want to help you find that and understand that a little bit better as you work in sports physical therapy. I've worked in pro sports for over 10 years. I opened up a cash-based physical therapy in sports physical therapy with 3 locations. And I've taken what I've learned in my residency, then working in pro sports for 10 years and applied that to my cash-based practice. And I want to share what that means for you, give you a little bit of framework behind the scenes and what to expect, how to do it, and how to find that balance. Whether you're married, you're single, you have kids, you have a dog, how do you find this balance? And I'm going to explain that in simple terms. If you were to look at 2 let's say basketball players, one is a professional basketball player, let's say Michael Jordan or LeBron James, right? If you look at their history, their credentials, their resume, both of them have different paths, but ultimately these are pro players who've probably been the best in their career paths. Now, when you see what they've done to get there, you have to realize that as a pro player, they probably had to do everything that the team was doing, practice and everything else, but they probably had to do extra free throws, extra 3-pointers when things weren't going wrong. Or maybe in high school and college, they spent their time on dribbling, on defense, a little bit extra. They stayed after. They showed up early. They worked on their sleep. They worked on their nutrition more than their competitors. And as their skill grew with more hours of training, 10,000 reps to learn a new skill, they spent that time in order to do 10,000 reps. They probably added in 500, 200 every day or 3 days a week so they can get to that 10,000 reps just a little faster, where their counterparts were doing the bare minimum. Maybe they were showing up to practice. They showed up 10 minutes early. They didn't do the free throws behind the scenes, but they showed up to practice. They were a great athlete, great participant, great team player. But after practice, they just went home. They collected their money or their scholarship or whatever it was. Both people have a role on the team. You have a role player who is, they play a specific role. They're there to support the person who is going to make the most free throws. They're there to block. They're going to be a little bit of a second string or a first string, but they serve the team, but they're not going to be a rock star or superstar. They're not going to be a legacy player that makes highlights and do those things. Whereas the Michael Jordans and LeBron James, they put the time in beforehand. They put the time in after. They went to practice. They try and get as much as they could out of those practices. And they added in 10,000 reps of the things that they were not good at then. It could have been dribbling. It could have been passing. Could have been the free throws. It could have been anything that they were working on. So you have 2 different players. You also have people who aspire to be that, but never achieve that. Maybe people in high school or college who wanted to be the best basketball player, but didn't really have the skill and they didn't really put in the work ethic. These are the hopium people. These are like, I hope to make the pros, and you watch them and they just kind of, they did the bare minimum. Let's apply that to physical therapy and sports physical therapy in particular, because sports is different. So for a lot of people, a sports residency is of interest. If you decide that sports residency is not for you, you can still do great in sports. I think you can accumulate 10,000 hours of certain things in a smaller condensed time, and that's the benefit of a residency. Now, what if you don't want to do a residency? You want to get into sports PT. Let's take the path of a rock star. Somebody goes all the way through to the pros, just as they should or could. Maybe they did a residency. They got a lot of 10,000 hours in a very short period of time. Then they did a fellowship, and they got another 10,000 hours of just solid skill sets, got good exposure that would be very difficult to do in a private sector. Then they got a job in pro sports. Then they got a lot of time. They were working long hours, long nights, and they worked in pro sports. And then they went on and moved on to more pro athletes or more pro things. So what happens here is that person, that sports physical therapist, gets a lot of exposure in a short amount of time. That is what develops your skill set. You don't have to do that to be phenomenal in sports PT. Now, let me share an example of somebody on the opposite end of that. Somebody who doesn't want to do a residency, which is okay. Somebody doesn't want to do a fellowship. Somebody doesn't want to do in pro sports, but they want to work with athletes. So you start to see now, maybe this is a hopium person. They're like, I don't want to show up before practice. I don't want to show up after practice. I don't want to do more things than is absolutely necessary. I just want to support the team, but I want to get some playing time as well. That's what you're saying. I want to work with a couple of little athletes here and there. Or you're saying, I want to work with a lot of athletes, but I just want to go to practice. I really don't want to have extra free throws. I don't want to do these things. And we put that in terms of PT, CEUs or courses, development courses, would kind of be like the extra free throws, the extra things, working with a mentor. If you're like, I don't want to do more free throws, I don't want to work on my 3-pointers, I don't want to work on dribbling. I just want to do that inside practice. I don't want to do more of that. And when you do that, you can now see if you're in a private practice sector, and maybe you're in an in-network, out-of-network, insurance, cash, whatever it is, and you work 40 hours, and your schedule is saturated, 90% productivity, 85% productivity, you can have barely a chance to eat, snack, and do some documentation. Now, what happens early in the career or later in the career, that physical therapist says, I don't want to work weekends anymore, I don't want to work nights, and I don't want to work during my lunches. I just want to do my 40 hours and I want to treat athletes inside them. What you're saying here is, I don't want to do more free throws. I don't want to do more 3-pointers. If you work 40 hours and you're 90% productive, you're working on the skills that you know. Your current dribbling, your current passing, and your current 3-pointers. You're working on just that. But in reality, you're not developing it. You're not increasing or enhancing the additional 10,000 hours. If you're working 40 hours and you're very productive, how do you have time to develop? How do you have that time to develop all the skills that you don't have? Well, let me guess. You probably say, I want to do 2 CEUs a year. Well, the retention rate is less than 10% on a CEU. And if you're taking the bare minimum, you're probably separated by 6 months or 2 months or 4 months. So you didn't have 10% retention. You didn't use most of that because you're not treating a lot of athletes. Maybe you took a programming course, a strength and conditioning course, and you're not treating a lot of athletes. Well, the information is diluted now and only 10% retention. And you take a taping class or a manual therapy class. If you don't treat a lot of athletes like that, you're not putting that into practice. You're actually not developing. So you're hitting the bare minimum. You hit your 2 CEUs. You don't want to work lunch. You don't want to work evenings, and you don't want to work weekends. Well, that's the player you become. You become the high score college hopium athlete. I want to be in the pros. I want to work with more athletes, but I'm not willing to put the time, the energy and development that it takes to do that. And you might call that work-life balance, when in reality, it's practice. You need additional reps. And if you don't want to put those additional reps, it becomes very difficult to succeed in working with athletes, because athletes require more attention. They have higher standards for themselves. They're going to text you. They're going to email you, and they're going to require a lot more energy. And that's fine. You just have to decide which one of those therapists are you. You have what I call the bare minimum physical therapist, which I do the bare minimum. I work my 40, no lunches, no evenings, no weekends. And I only do my 2 CEUs. And then you have the person who's willing to work and put in the time to develop more reps when they're not paid, when they have to pay things out of pocket on their own. That is equivalent to the Michael Jordan and the LeBron, who wants it more. They want the championship. They want to work with more athletes. And guess what? Those are the people who get more athletes on their schedule, who retain them for longer, and who aren't treating inactive, immobile, lazy people who don't show up on schedule and don't want to be there. So if you're caught up with the schedule of people who don't want to be there, a lot of workers' comp, a lot of low back pain, who are doing it for insurance or motor vehicle accidents or whatever, and you want to get to people who are active and want to be there, you have to put in the time, and it's your decision. It's not whether your skills are good enough, is do you have enough practice, and are you putting that time and work and effort and energy to be beyond the bare minimum physical therapist? Is there work-life balance in sports physical therapy? Absolutely not. You'll go through ebbs and flows of this, where you have seasonality to this, where maybe in the summer you have lower athletes, but then it picks up in the fall because you have a lot of cross country and football, and in the spring you have maybe wrestling and baseball. You have these ebbs and flows, but understand the work-life balance just becomes based on volume of the number of active patients you had. So if somebody said, hey, I'm going to give you a schedule full of athletes, would you take it or would you not? You would absolutely take it. But then how do you retain them? The amount of work afterwards, the evenings, the nights, the weekends, to be able to program for them so they're successful, to match their standards. Now, the standards of a typical orthopedic patient will be low, and that's the standard that you work towards. So if you want to have those patients on your schedule, do the bare minimum, those are the standards you're working towards. If you want higher standard athletes who want more with you, want to work with you, then you need to increase your standards. So do you want to be the bare minimum physical therapist or the true sports physical therapist? That is completely up to you. So does work-life balance exist in sports physical therapy? No. And you have to find, is that the route that you want? And there's nothing wrong with that. But ultimately it comes down to, what do you want out of your career? So there you have it. If you're looking for work-life harmony, work-life balance, you then have to rethink, is this the career path that you want? That's the better question, not how do I achieve more work-life balance? Enjoy. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.